Hi everyone, this is Anita with Alliance Academy. I am back again with lot more videos to help you beat all kind of nursing exams. So today I am going to do a presentation about ABG interpretation in acid-base imbalances. So before you proceed to the interpretation, we should know about the normal ABG values. So when you look at the ABG results, we do see a lot more test values, but we should know only important test results that I am showing here. As you can see, the first one is pH. The pH of blood is normally ranged between 7.35 to 7.45, and the partial pressure of CO2, it's 35 to 45 mm of Hg. PO2, that is 80 to 100 mm of Hg. Bicarb or HCO3, it's 22 to 27 milli equivalents per liter. So before you interpret the ABG results, we should know the normal values of the ABG. Okay, so you should keep in mind before you interpret the ABG values. Okay, so next I will show you the test value changes that we usually see in acid-base imbalances. So here you can see in acidosis the pH is always decreased, that is it is below 7.35. So the normal value is 7.35 to 7.45. So in acidosis it is always decreased, that is below 7.35. And in alkalosis the pH is always increased above 7.45. So that is the difference in pH value when it comes to acidosis and alkalosis. pH is decreased in acidosis and pH is increased in alkalosis. So when you look at the results, when you see a decreased pH, you should know that it is acidosis. And if it's above 7.5, it is alkalosis. And also there are two different kinds of acidosis and alkalosis that we deal in ABG. So the two different kinds are the respiratory and the metabolic. So we should differentiate which kind of acidosis or which kind of alkalosis is this. So the respiratory function indicator is the PCO2. Okay, so when you see differences in PCO2, that is usually the respiratory indicators. The metabolic function indicator is the bicarb or the HCO3. So if you see changes in HCO3 or the bicarb ion, then it is metabolic. Okay. Now we can see how to interpret ABG results. So there are few steps that you should follow before you interpret the ABG. Okay. So the step 1, as I said before, you have to look at the pH. So if it's elevated, it reflects alkalosis. If it is decreased, it reflects acidosis. So keep in mind, if it is above 7.5, it's alkalosis. So just keep in mind that it is alkalosis. Okay, and then go to step 2. In step 2, you look at the PCO2, the partial pressure of carbon dioxide. Okay, so if it reflects the opposite relationship to the pH, then the condition is respiratory imbalance. So if the pH is increased and the PCO2 is decreased, it's opposite relationship. Okay, or else if the pH is elevated, the PCO2 is decreased, that is also opposite relationship. So then the condition is respiratory imbalance. Okay, all right. So you should know that if the pH is elevated, it is always alkalosis. So to be respiratory, the PCO2 should be decreased. Okay, so if the pH is elevated and the PCO2 is decreased, then it is respiratory alkalosis. Okay, pH is elevated, that is alkalosis, and the PCO2 is decreased, so opposite relation, so it is respiratory alkalosis. And in the same way, if the pH is decreased and the PaCO2 is increased, so pH is decreased means acidosis. So there is opposite relationship with the PaCO2. So it is respiratory acidosis. Okay. And then if you don't see any opposite relationship, then go to the step 3. Or even if you see opposite relationship, you can always go to the step 3 and check if there is any metabolic factor 2. Okay. So when it comes to step 3, look at the bicarb, because bicarb is the indicator of metabolic imbalance. Okay. So the bicarb shows the corresponding relationship to the pH. Okay, that means if the pH is increased, the bicarb is also increased. So same relationship, corresponding relationship. Okay, so then the condition is metabolic. Okay, so if the pH and the HCO3 decreased, so decreased pH is always acidosis. Okay, so the bicarb is also decreased, so it is metabolic acidosis. If both are increased, it is metabolic alkalosis. Okay, hope you understand. Alright, and there are two different kinds that we should look into too. That is, if it is compensated or uncompensated. Okay, so the one I explained before, like the step 2 and step 3, it is all uncompensated because the pH is either decreased or increased. Okay, in compensated ones, the pH is always normal. Okay, so if the pH is normal, it is compensated. If the pH is decreased or increased, like I explained before, it is either acidosis or alkalosis. Okay, and let me show you some practice questions so that you will understand it better. Okay. Alright, so the first practice question, as you can see here, the ABG result shows pH 7.45, PCO2 30, bicarb 20. So what is this condition? Is it metabolic acidosis compensated, respiratory acidosis compensated, metabolic acidosis uncompensated, or respiratory acidosis uncompensated? Okay. So here the pH is normal, but it is towards the highest value. Okay, so when you look at the PCO2, it is 30, it is low. So normal is 35 to 45, it is low. Bicarb is also a little bit low, but it is not too low compared to the CO2. Okay, so we can consider this as pH. Even though the pH is 7.45, it is more towards alkalosis. Okay, and the PCO2 is 30. Okay, so here the answer is, can you tell, or can you? I'll give you some time. Okay, so it is respiratory alkalosis. Okay, okay, but you can see that it is compensated also because the pH is normal. Okay, so it's respiratory alkalosis compensated. Okay, and the next one, the pH is 7.12, PCO2 90, bicarb 22, and which is this condition. Okay, so here the pH is not normal, it is low. So it's always, if the pH is low, then the condition is acidosis. And when it comes to PCO2, it is high. So opposite relationship. Okay, and the PCO2 is the respiratory indicator. Bicarb is normal. So this is obvious that it is what condition? Respiratory acidosis. Okay, and the next one. Okay, so the client is experiencing respiratory acidosis, which results validate this finding. Okay, so in respiratory acidosis, what are the findings? I have given 4 options. Okay, look at the options and choose the right answer. Okay, so in respiratory acidosis, what happens in acidosis? The pH is lower than the normal. Okay, so here only one option that shows lower pH. Okay, there is one in the second option shows 7.35, but that is towards normal. But the PCO2 is normal there too. So that cannot be the answer. And the only one option is the first option, pH is 7.25. Okay. And to be respiratory acidotic, the PCO2 should be higher than normal. Okay. Opposite relationship. pH is lower and pH is decreased, PaCO2 is increased. So here only one option shows the opposite relationship. Okay, 4 shows opposite relationship, but the pH is 7.52, that is alkalosis. Okay, alright, hope you understand. If you have any questions, you can send me a message. Alright, thank you for watching. I'll keep uploading lot more videos that will help you to beat all kind of nursing exams, and I'm going to explain each of these acidosis and alkalosis in a different video, so wait for that. Thank you.